All right. Well, good day, everyone. Welcome to Revelations webinar on weight loss. My name is Baylor Rice. I'm one of the pharmacists and clinical liaison at Revelation Pharma Corp. So welcome. So glad you could join us today. Um, we'll just kind of dive right into things, quite honestly. Overweight. The obesity trends in America is really just keeps getting larger and larger. You can see with the data on overweight, 10% overweight, and then each kind of year and decade, it kind of keeps growing. So the trends are only trending up, and they have to make new classifications for obesity. And basically, BMI greater than 30 or about 30 pounds overweight for a 5'4" person is what really falls in that classification of overweight. So things have really changed over time as far as our food state and our food sources, but our genes haven't changed. But certainly the environment has. According to the thrifty genotype theory, few, if any, changes in genes or gene sequences have occurred over the past 10,000 years. Kind of interesting concept when you stop to think about it. So what's part of the problem here? Certainly our fast-paced environment, the misunderstanding impact of poor food choices and how they really compound. Right. I mean, something every so often, for instance, a hot dog with some fries, and this is a chili dog with some cheese on it. Every so often, all right, well, the body can handle that, but making a poor decision today and then another one tomorrow, and then maybe two poor decisions the next day, certainly that starts to stack up, right? And so many of these things are just kind of the easy, comfortable foods that we can kind of fall into the trap of choosing, the high fat, high caloric intake. So really that's kind of going to that bottom line. That's going to that waistline. So other contributors to the problem, certainly the toxicity in our food, pesticides, herbicides, heavy metal exposure, all the different things that are used to keep bugs and make things look pretty, if you will, in the grocery store shelves may not be the best for our genetics or the expression really of our genetics. So certainly we want to try to eat as free range, as organic as possible. All of that does make a difference. And it's just, are we going to pay for it today in having a little bit more expensive food, or are we going to pay for it long term with ill health? So some other things certainly that are adding to the problem are those sodas, right? High sugar food and beverage selections, the pizzas, the cupcakes, donuts, all the yummy things, right? And I'm guilty of it myself too. I'll enjoy a treat every now and then, but again, it's having them less frequent and not more frequent, and trying to avoid the processed sugars as well as the artificial sugars. Hidden sugars are in processed foods, things like salad dressings. If you've looked at many of the condiments, you've got high fructose corn served in the condiments. And also those healthy grain cereals, etc. What we can do to really minimize those and bring in some protein and that sort of thing into our diet is a much better choice. So when we continue to look for a solution, the Gallup poll asked many Americans, how many different times have you tried to lose weight? And this is really kind of interesting when you look at it. The number of weight loss attempts is steadily increasing. So those that, back in the 90s and then going up into 2005 have tried it at least once. You can see that's increased twice, 3 to 10 times, more than 10 times. That's even more than doubled from a decade or two ago. So certainly more people are trying different things, trying to figure things out. So what we can do to minimize that. So one in three people in the US have metabolic syndrome. So really the question is, are you one of them? They'd be thinking, well, what is metabolic syndrome? Metabolic syndrome is a name for a group of risk factors being linked to overweight or obese. They're also associated with an underlying low-grade inflammatory process, which this syndrome is used to be called syndrome X or insulin resistance syndrome. So if you have three of these five risk factors, then you can really kind of fall in that metabolic syndrome category. So if you have an elevated waist circumference, for men, that's greater than 40 inches. For women, that's greater or equal to 35 inches. If you have elevated triglycerides, so if those are greater than 150, so personally, I like the triglycerides less than 100 is where I target for my patients. Reduced HDL. So for men, when that HDL is less than 40, or for women, when that's less than 50, then that's putting you at greater risk for metabolic syndrome. Elevated blood pressure. So when that's systolic is greater than 130, or greater than 85 for diastolic, or if you're on drugs for, medications for treatment of hypertension. As well, if you've got an elevated fasting glucose. So if that fasting glucose is greater than 100, or again, if you're on treatment for that, then that can be a problem, right? So there again, if you've got going through and you're checking off three or more of those, then we need to be thinking about metabolic syndrome for you. So what other conditions are associated with metabolic syndrome? Metabolic syndrome risk factors increase your chance of having a heart disease and other health problems such as diabetes as well as stroke. So if you're diagnosed with metabolic syndrome, you are about 9 to 30 times increase the risk to develop type 2 diabetes. That is huge, folks. Absolutely huge. And 2 to 4 times increased risk to develop heart disease. Now, of course, we all know, at least hopefully most everybody knows by now, heart disease is the #1 killer for Americans. So we really need to get this under control. So it's also associated with a number of other things, right? So dyslipidemia, so having your cholesterol off, high blood pressure, erectile dysfunction for women, PCOS, dementia, cognitive decline, a variety of forms of cancer, kidney disease and damage, osteoporosis, NASH, which is fatty liver disease, certainly obesity, sleep apnea, sarcopenia, as well as type 2 diabetes. So all of these things really kind of tie in and offshoot to that insulin resistance. So us not able to handle the sugars and processing the sugars properly in the system. So conventional medical therapy typically requires that each of the metabolic risk factors be singled out and treated separately, resulting in multiple prescriptions. Well, this means you would need a prescription for high cholesterol, high blood pressure, high blood sugar, right? Well, let's kind of turn back the hands of time. And well, are there some other options for this? And absolutely, the answer is yes. There's a lot of things that we can do nutritionally and with supplements and working with your diet to really help to reverse this piece. So the use of really combination of diet, lifestyle factors. Generally, we're going to pull in things like fish oils, omega-3 essential fatty acids, bring in protein shakes to really kind of help with the management of these risk factors and decreasing those. So we do have lots of good data showing that this is achievable, as well as I've been able to reproduce this data over and over and over with my patients over the last 25 years. In 180 overweight subjects with the metabolic syndrome after 2-year lifestyle program focusing mainly on a Mediterranean style diet, there was a 48% net reduction in the prevalence of the syndrome. That's huge, absolutely huge. So when you look at this, certainly this is some other data for you, 49 subjects with metabolic syndrome and hypercholesterolemia. So that's high cholesterol, right? So you've got exercise. We want 30 minutes, 5 times a week, modified Mediterranean food plan. So they found 22% of the subjects no longer met the criteria for metabolic syndrome. Now, when we added in fish oils and we added in a protein shake, that number doubled, well, almost doubled. It went up to 43% no longer met the criteria for metabolic syndrome. So can you do it by yourself with diet and exercise? The answer is yes, but ultimately, can we do it faster than just diet alone and exercise? The answer to that is absolutely yes as well. Okay. So more study data for you, so you can further kind of get an idea of, yes, this isn't just kind of a one-off thing. 89 women with metabolic syndrome recruited at the University of California at Irvine, University of Florida, and University of Connecticut. They were randomized into 2 arms with 12-week intervention trial. So 44 in the control arm, 45 in the treatment arm. Again, we had the modified Mediterranean diet, food plan. 32% of the subjects no longer met the criteria for metabolic syndrome. Adding in the shakes, 44% no longer met that. Again, reproducible data when you stop to think, okay, 43% here, and another study, 44. That's really tight with what we're seeing over and over. If you have a condition related to unhealthy cardiovascular health, blood sugar levels, or body composition, you're at a critical crossroads where you can take control of your health. By taking action now, you can start to feel better and enjoy more years of active living to do the things that you enjoy, right? So, we all want to enjoy our kids, and then I don't have grandkids yet, but certainly one day want to, and I want to be able to enjoy those little guys and watch them grow up as well. So I take it serious, taking good care of myself, taking care of my health. So likewise, I do the same for my patients. So ultimately, safe, no serious side effects, no adverse events reported, right? It's using let food be thy medicine and adding in some extra fish oils and adding in some protein shakes to kind of speed things along, right? So it's perfect for patients with metabolic syndrome who want to achieve a healthy body composition. So in both clinical trials, patients lost on average about a pound a week. So, if you're looking for the 30 pounds in a week, nope, this isn't for you. It is going to take a while, but yet the trick really is teaching you how to eat, having a good relationship with food so that when you get to where you want to be, you're able to maintain it and not just bounce around, right? So many people I've seen over and over, they'll lose 10, 20 pounds and then, slide back into their old habits. And all of a sudden that 20 pounds comes back on as 25 pounds, right? And then that just adds to the frustration. So a lot of folks will just kind of throw in the towel and say, the heck with it. Doesn't matter. Let me eat whatever. Well, that's not certainly a good choice long-term for your health. So benefits. Making significant improvements in the risk factors associated with metabolic syndrome and cardiovascular disease. So ultimately losing fat and increasing muscle is absolutely key. Increasing energy, decreasing those carb cravings and sugar cravings. Easy to do, right? Especially once you kind of get in the habit and kind of get new routines and a new rhythm for yourself. This is scientifically designed, includes, of course, targeted nutrition, a healthy eating plan, simple exercise, basic recommendations for stress management. sounds easy because really, quite honestly, it is. It's just commitment, right? And it's sticking to it and staying with it. And I get it, got it. That's the hard part sometimes, right? But you can certainly do it, and with the help of uh, one of your Revelation pharmacies nearby, they can certainly help you to achieve that and stay on track. So we generally will have a patient guidebook that kind of goes through, and this kind of goes through and shows you some different recipes, when to eat what. Ideally, now granted, everybody is a little bit different, but for the vast majority, eating smaller, more frequent meals versus large, less frequent meals is part of what helps with that insulin resistance and dysglycemia piece. Using a medical food, so using a very specific protein shake that helps to go after metabolic syndrome and decreasing those cardiovascular disease risk factors. So what is a medical food? It is regulated by the FDA, specifically formulated and intended for the dietary management of a specific disease, and can make a specific disease claim. Contains ingredients that are generally regarded as safe. All efficacy claims must be based on recognized scientific principles and sound clinical data. Other non-medical foods are considered functional foods or supplements, and they may contain non-GRAS ingredients, and they cannot make specific claims. So there is a difference with having that medical food designation. Low glycemic index formula to decrease insulin burden. So results of more than 15 published studies have demonstrated increased satiety and delayed return of hunger after eating a low glycemic versus high glycemic foods. Protein. We need in the morning, you need at least 15 grams of protein to start the day. I grew up hearing, oh, breakfast is the most important meal of the day. Well, guess what? It's also the most important meal of the day for protein. So if you're only going to get protein once a day, which I do recommend more than once a day, but if for this discussion right now, I would want that at breakfast, right? Because that's going to set up your glycemic index for the rest of the day, which is how you're handling your sugars. So non-genetically modified protein, and we'll use in the different shakes, we'll use soy protein, we'll use whey protein, pea protein, rice protein. So we've got lots of different protein sources depending what your food sensitivities or allergies are. So we can kind of pivot depending on that, certainly. Plant sterols. Plant sterols help to support healthy cholesterol levels. So the National Cholesterol Education Panel of the NIH recommends consumption of 2 grams of plant sterols daily, along with healthy eating and exercise to reduce the risk of cardiovascular disease. Well, that's what we're doing. Studies have shown that 1.3 grams of plant sterols per day are needed to show a significant cholesterol lowering effect. SCRMs. SCRM, that stands for Selective Kinase Response Modulator. These come from reduced isoalpha acids and acacia for improving cellular signaling. So this comes from a hops extract, is what that is, fancy hops extract. 30 times greater statistically significant decrease in triglyceride levels, 3 times greater decrease in fasting insulin, 87% greater decrease in 2 hours postprandial insulin, 44% lower level of fasting glucose, over 4 times greater decrease in 2-hour postprandial glucose, and a decrease of minus 1.12 in triglyceride to HDL ratio versus a plus 0.11 in the placebo group. Again, I share this with you, so data, right? There's data behind what we do and how we do it. Why? Because results matter to us, and we want to see you achieve what your goals are and get you there. So optimal foundation nutrition. So enhanced micronutrient profile to supply 35% or more of the RDI for most vitamins and minerals, including 600 milligrams of non-dairy calcium, 400 micrograms as folic acid, and that's a L-methyl tetrahydrofolate. So that's methylated B's, full spectrum of B vitamins. Modified Mediterranean diet with low glycemic load. Lots of color, as you can see in the background, right? Lots of color of veggies and fruit, fresh, organic, and all of that is in the patient guide. So that kind of helps guide you through it. So that really does help with lowering that metabolic syndrome. Exercise. So I don't tell patients that you have to go join a gym or buy a fancy piece of equipment. Really, you can achieve it with just a 30-minute brisk walk 5 days a week. Great place to start. If you haven't been doing anything, depending on your age, for some folks that, that are just starting at 75 years old and, Baylor, I haven't done anything in a long time, start with 5 minutes a day, right? And then work it up to 10 minutes, and then 15 and 20, and then you can make it faster, right? Ideally, we want you sweating when you're walking. So we want to get that heart rate elevated. You can also add a resistance with training to help build muscle. Stretching will also help to improve flexibility and aid in the muscle recovery. So, start here, and then we can add some resistance. And then, of course, I think stretching is good for absolutely everybody. I recommend that because as we get older, we tend to get more tight. And then as we get more tight, then we're more likely to fall or lose our balance or something. And then we can fall and break things and pull things. And that's never good either. Stress management. Oh, Lord, stress affects so much. When you really look at driving primary care visits in the US, 85% of them are driven by, in some way, shape, or form, stress. So we've got to get stress under control, and stress is one of those things. Our level of baseline of what we've come to accept has really increased dramatically the last 3 years, but even going back further than that, last 10 years. So do something 20 minutes a day, kind of find that peaceful place for yourself, whether it's reading a book, doing some meditation, listening to some music. Do something at least once a day, 20 minutes to kind of help decompress. Bioimpedance analysis. So this is a test we can do if you live next to or close to one of the Revelation pharmacies that offers this. It hooks up a lead on the wrist and the ankle. It throws a small current through the body. So what it measures is fat mass, muscle mass, intracellular fluid, extracellular fluid, and basal metabolic rate. So it gives you some wonderful information. So it helps us help you to be able to lose weight. Because if you've got more water outside the cell than you have inside the cell, it makes it very difficult to lose weight. Okay. So when that comes about, then generally that's a sign that we need to detox or do something. So if you've ever lost weight, so think about it this way. Toxins get stored in fat. So as you're losing weight and the fat, we want to be decreasing the fat and not muscle, right? We want to maintain the muscle. So the nice thing about this test is we can measure that muscle, right? We can measure that fat-free mass and see where that is, and watch the fat mass decrease. So if as we're doing this, you're losing the fat's releasing toxins are getting in the system, then that can affect that extracellular water balance. So generally, I find about every 20 pounds of fat loss, we need to do some sort of little detox. And I don't mean necessarily going out in the woods and, just drinking berries or eating berries and drinking lemon juice for 30 days. But more of a cellular type of detox program. Okay, so we can get a balance with that. So again, what's nice is we can really watch that fat decrease and while we're maintaining that muscle mass. And that's really the trick, right? Is getting rid of that fat and helping to increase the lean muscle. Absolutely huge. So if you've seen some of our other webinars that I've given, I use this slide very frequently because I think a picture is worth 1,000 words sometimes. So if we have quality of health here and we have age, so as we age, you can see, well, gee, wait a second, quality of life starts dropping off. And it's funny, it's not 50 and it's all downhill. It's actually about 35, folks. So the trick is keeping this bar as high as possible, as long as possible, even if no matter what we do, the endpoint is the same, no matter where that endpoint is. I want this bar up as high as we can, right? I want to go like a banshee and then just one day drop dead and be gone. So that's part of this metabolic syndrome because it's kind of one thing kind of starts and then that leads to the other. Add extra fat mass on, keep gaining 5 pounds a year, adding that on. The next thing you know, the blood pressure is going up, and the next thing you know, the cholesterol is increasing. The next thing you know, the blood sugar is increasing, and then you're kind of left, oh my goodness, what in the world just happened over the last 5 to 10 years, right? So it can creep up on you and sneak up on you rather quick sometimes. So we want to keep this up, guys. So here's some feedback that I've gotten from some patients through the years. Baylor, because of my success story with the program, I've encouraged our friend, of course, for HIPAA sake, we're using initials here, to attend. I think she will sign up. Karen did a wonderful job, and I learned lifelong lessons that will keep me in the position I want to be. Thanks to you and Karen, I lost 45 pounds. I went from a size 14 to a size 6. So very exciting. So this is from Arlene, 26 years old. Besides the obvious weight loss, my stress levels have decreased because I have more mental clarity to work through challenges. My energy levels have increased. The program was a challenge at first, but once I started to feel better, I won't go back. And that's not too unusual. We'll see that, it does take a little bit to develop new habits, right? And so once we get those new habits, then we can kind of start working them in, and then we kind of see the snowball starts happening in the positive direction, right? This is from Lady Maria. I've always struggled to lose weight. At the beginning of the program, I did experience a lack of energy. However, after about 3 weeks, my body seemed to adjust with the help of the supplements provided, and I regained my energy. Even though we are bombarded with the convenience of bad food everywhere, I plan on continuing this way of eating with a little planning, which I learned from the program. It is a manageable lifestyle change. And so I wanted to include this in here just because this is so key, right? Planning, 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 planning. We just have to plan ahead. So, personally, when I travel, when I go on the road, I take a cooler with me, depending how far away I'm traveling. Then I'll go and get some meats and that sort of thing so I can have some good, healthy snacks in the car versus having to rely on fast food. But certainly there are better choices when you're traveling than others. So it's making the best choice sometimes that you've got, but a little planning can go a long way. Other reported success: improved body composition, improved sleep, decreased pain, increase in energy, improved mental clarity and stress levels. Additional things that observed, certainly overall attitude improved, increased confidence, and really that glorious glow. So having that glow and affect of, oh my goodness, I just lost, whether it's 5 pounds or 50 pounds. And just the psychological piece that goes along with it, but the feeling, right? It's absolutely fantastic, and I love seeing that, and I get so excited for patients um, as they're able to kind of get a new set point, if you will, right, and accept a new level of what's normal for them. So a couple of things here I wanted to share some of my favorite products that I'll use along in this process. You've heard me talk about fish oils, omega-3 essential fatty acids. And why is that so very important when we're talking about weight loss? Is because, if we've got a cell, we've got the nucleus of the cell, which is like the brains of the cell. We've got the mitochondria, which is the engine. So we eat food. Food gets turned into a usable sugar, glucose. And the pancreas secretes insulin, and the insulin serves as little channels to get that glucose into the cell. So you've heard me use the term insulin resistance, dysglycemia, syndrome X. Ultimately, that leads to diabetes. So the more stiff and rigid the cell wall is, the more likely it is that that insulin bounces off. That's insulin resistance, folks. That's where that kind of terminology comes from. So fish oils help with the permeability of that cell wall membrane. So the more we can make that cell wall membrane fluid and permeable, right, and pliable, flexible, the easier it is to get things in. And then what's in the shakes? So the micronutrients, the macronutrients, the amino acids help to further transport it to the nucleus. So that sends signals to the mitochondria. And the mitochondria is like the engine to the car. It's burning that fuel, right? So it should be as simple as energy in equals energy out, right? But, things get in the way of that, right? So our pure mono omega 1300, so it is 1300 milligrams of EPA and DHA per capsule. And so what this is it's a mono form of omega-3. So it increases the absorption of it. So you get about 3 times the absorption. So in essence, you're able to use less of this than your typical standard fish oil. We also have the 650. The reason why we've got one that's about half, because the 1300, that capsule is pretty big, right? So that one's about half that size. So for those that have swallowing problems, in the shakes do have some bees in it, but typically most people are stressed and they're burning through their bees. So I like doing some methylated bees along with it to pop those up higher. So that's going to be rich in methylcobalamin as well as 5-methyl-tetrahydrofolate and the complement of other Bs with it. And then the shakes. So this is sugar-free and stevia-free, because we found some folks were having some issues with stevia, and sometimes that aftertaste can hit people. We call it our optimal protein, available in vanilla as well as chocolate. And then we've got our optimal DGI formula, also available in vanilla and chocolate. And what the DGI piece stands for, D is detox, G, gut, and I for inflammation, right? So if somebody that is really more heavier deep into metabolic syndrome, numbers are just absolutely goofy. They've got lots of inflammation, or the bioimpedance analysis, the BIA test that we did, is if that's off, then certainly this is going to help decrease that inflammation, help support the detoxification pathways. So those are a couple of my favorite formulations that I'll use. Now, typically, I'll use a shake as breakfast, and then bring in some nuts and maybe a little bit of fruit for a morning snack, a healthy lunch, like a salad with some grilled chicken or grilled fish, or certainly if you want some vegetarian options as well, with some nuts and seeds, a vinaigrette type dressing on it, and then afternoon using another shake. And that's going to help hold you until dinner. And then dinner, very much like lunch, a salad with some grilled chicken, grilled fish, or some tofu or something like that on it with some other veggies, oil, vinaigrette type dressing, trying to avoid those heavier dressings, trying to avoid and limiting the sugar on that. So that's going to help keep a more stabilized blood sugar through the day, and ultimately be able to decrease the fat mass, get better control of your triglycerides, lowering the cholesterol, helping to get balance of the blood pressure, and ultimately decreasing that waist hip ratio, which is what we all want to achieve, right? So I can't encourage you enough. Start today to lose weight and feel great, even if it's just 5 pounds. The real data to make it really black and white is the more fat you carry, the faster you're going to die. That's as plain and simple as I can make it. So let's pull off that fat, even if it's 5 pounds, 10 pounds, 50 pounds, 250 pounds, whatever it is. Let's decrease that fat mass as much as we can so we can get you feeling good, get the energy back, get the brain working good, and help try to decrease some of those pharmaceuticals that you're on